Subvariants, BA2, I know that's on people's minds now. It's a subvariant of Omicron. The question we get is, are we going to see a surge related to BA2 coming forward? It is now the dominant form of SARS-CoV-2, and it's thought to be 30 to 50% more contagious than the original Omicron variant, which we know was already very contagious. So because of this, we do expect in the coming weeks to see some uptick in cases. We currently don't expect to have hospital capacity issues like we did with Omicron. At this point, vaccination rates and natural immunity increased with this last surge that we saw with Omicron. So we're hopeful that this will run its course without major disruptions, but I think we have to be prepared to be able to pull levers and change things if we need to based on the amount of COVID we're seeing in the community. Another slightly positive note is that the evidence so far indicates that BA2 does not cause more severe disease than Omicron in vaccinated individuals or those who've been previously infected. So if you haven't been vaccinated or you haven't had COVID recently, you should be more cautious as we think about BA2 and maybe rethink getting vaccinated. The other variant I'll mention is XE. You've seen that out there. I think people didn't realize that this is a subvariant of Omicron as well. We've already been through XB, XC, XD, and now there's XE, but this one has hit the media. It's kind of a combination of BA1 and BA2, not anticipating anything more severe with XE either. So I think that we may get to a point where there's an annual COVID vaccine, at least for some people. I think we have to see what the information and data shows, particularly around young people who've had COVID or had several doses of vaccine. Do they really need an annual vaccine? I think that remains unclear. To date, I don't know that they will, but we'll have to see. I think it's a different issue for those who have chronic medical issues or don't respond well to vaccines. Say someone who has cancer is getting chemotherapy, they're not going to respond to vaccine as well. And so they have to be thought of in a different way. I think the challenge for public health initiatives and CDC and FDA is in a country of 350 million people, trying to put a one-size-fits-all approach to vaccination of COVID on the population really doesn't work very well. It's much more nuanced than that. And so I hope what they're doing is having discussions about what are some clear guidelines the public can understand and physicians can understand that take into account the differences in people. As we've talked about in this call, younger people who've had COVID, been vaccinated, do they really need a yearly COVID vaccine? Well, maybe if a variant comes that has some immune escape, maybe that's a good idea, but we may find that those people don't need it, but other vulnerable populations do. So all that's going to have to be worked out. As many people have said in all sorts of media outlets, we can't boost our way out of this. Giving people boosters every 4 months indefinitely is not going to be the answer, and I think it's unnecessary. But the question would be, how are we going to settle in? Will COVID become seasonal? Right now, it hasn't really been seasonal. We just every few months we get a wave. So it's not like influenza, which is typically kind of an October to March phenomenon. If COVID became more seasonal, that would change how we think about things when those vaccines are available. I would anticipate in the fall, there's going to be a more Omicron specific version of vaccine there and some recommendation on whether it should be annual and who should receive it.